Hello, and welcome to Partnership Live, our monthly discussion with New Jersey leaders who are changing the paradigm in maternal health. I'm Mariekarl Vilceus-Talty, and today I'm joined by Ed Jimenez, President and CEO of University Hospital. Hi, Ed. How are you?
Hey, Mariekarl, how are you doing today?
I'm doing wonderful. Thank you for taking the time out to speak with me. I know that you're very busy.
Oh, of course. Thank you for asking us to join.
Absolutely. So I know that you are leading transformational change over at University Hospital, but if you weren't in your current role, what would you be doing?
I think I would own a sports bar and
Okay.
I would be the bartender
Okay.
because I would love to hear everyone's story
Mhm.
and I would be thinking about how do I impact each one of them.
Excellent. Excellent. So do you have a signature drink that you would make as a bartender?
No, I'm extraordinarily boring, so just a regular beer kind of person. Um,
Okay. Okay.
yeah, no, it's less about the alcohol and food. It's more about the
The
different personalities you meet all the time.
Yes, that is absolutely true. Very, very interesting. And just coming off of Hispanic Heritage Month, I know that you are Argentinian. Is that correct?
That is correct.
Anything special that you did to celebrate or uplift Argentinian culture for the month?
Well, so I definitely ate more Argentinian food than I have before, which is sort of a thing that I try to do.
Mhm.
It's on the heels of Argentina winning the World Cup this summer, which was an extraordinarily big deal. And
That is
then I introduced my kids who were born in the United States to more cuisine. So little by little was sort of a month to recap and touch back to my family's history.
definitely a lot to celebrate. Thank you. Thank you for sharing that. So I know coming back to University Hospital, I know some of the background you were at St. Joe's prior to, and then you left, and now you're back at University Hospital as the president and CEO. So that's kind of a homecoming for you. So what was that experience like?
Oh, it's been phenomenal. For me, it's warming to my heart to see so many people that I knew. So I worked here at university almost 20 years ago.
Oh, okay.
So 20 years ago, I was here and when I returned, I saw so many faculty that I used to know, a lot of staff. And so it's been fulfilling to see how many people have still been here. And it's also really rewarding to come back to the city. I mean, the city of Newark, just on its own, is quite historical. It has so many amazing things. And then when I get to visualize what's transpired in the time that I was gone, the city really has regentrified. And University Hospital continues to be this magnificent academic medical center that people trust. And with our connection to New Jersey Medical School, you have this fantastic academic environment.
Mhm. You're absolutely right. And leading one of the largest healthcare systems in one of the largest, most diverse cities, I know it can be challenging at best, but what are some of the biggest opportunities and biggest wins that you faced so far regarding maternal health?
Well, I think when it comes to maternal health, I think what's clear to all of us is that patients who come to University Hospital, patients in really all of Essex County, um, have a series of other conditions when they come to us. And so we are going to continue to advance knowledge, information, and coaching because I think it's very clear to all of us that if moms can deliver in a better state of health than where they started, we have a much better chance, better chances of outcomes for both mom and child. And so I think it's both a challenge because we sort of have to work ahead of the curve before somebody gets pregnant. Certainly by the time they're pregnant, launch into a very robust dialogue. But the opportunity is wonderful, right? We're going to have people that will go through an experience in better health, so that's a plus. We'll have people that, if we're successful, will on the other side after delivery, we'll have a different kind of recovery period and a different kind of life going forward. And then certainly for the babies, we want to give everybody a chance to have a healthy start, and I think that would be beneficial.
Yeah, absolutely right. And University Hospital is doing such a great job. And you guys have been so supportive with the expansion of our doula project, the community of caring doula project, specifically in Newark. Can you talk to me about how you see the doula's role in promoting a healthy pregnancy?
Well, I think at its core, what I value about doulas is how they interconnect deeply with the entire medical team. If for us, it's not an add-on, it's not sort of this separate thing you have to give, a lot of robust consideration to. They meld tightly because they bring to the table a level of commitment and knowledge and a sort of social being that inside of a hospital is so necessary. Inside of a hospital, doctors have a finite amount of time, nurses have a finite amount of time. The service we provide can sometimes be very episodic. And so when you have somebody that can almost function as a coach on a team, right? In many respects, and you and I, if we Google it, we will read the word coach, but often if you then read what you Google, it's about coaching the mom. I will suggest to you that the doulas can function as a coach for this team, participating, right? And so in the world of baseball, there's the manager, but then there's a bench coach, and then there's a pitching coach. I think doulas fit part of the coaching team and they can interface. So I think what that brings is a deep level of information sharing and connecting dots. And when we can connect dots, we're going to be much better at finding those areas where something's missing or a deficit or somebody didn't understand. Right? You and I can pick several things that could be better. When you have a doula in the equation, it's just one more piece of the coaching team that can get it all done.
Absolutely, that's such a great answer. And I know this is not your first foray in working with doulas. In our previous conversation, you talked about initially working with doulas at St. Joe's. Do you see any difference or how it's really evolved and changed so far?
Well, I think there's a big difference. So here at university, we are aligned tightly. In fact, almost every single physician here is from New Jersey Medical School, a medical school. And traditionally, across the United States, medical schools work in the world of physicians. Dental schools work in the world of dentists and oral surgeons. And so when you have, whether it's doulas or midwives or nurse practitioners, they tend to be sort of separate worlds. And so what I value, quite honestly, is what Dr. Gittens and Dr. Campbell have done here, which is broken down this idea that it's separate, and it really created a oneness. So at St. Joe's, because they didn't have a medical school, you didn't have to, there wasn't this division. It just was, what do you do? Here, the possibility existed for a division, but Dr. Gittens and Campbell have done such an amazing job of creating oneness that I find that to be extraordinary, because otherwise medical schools, and it's no fault of theirs. They do their thing because they're in normal times doing their thing. But at New Jersey Medical School, it's different. And I think that's special.
Absolutely. I have two questions piggybacking onto that. Well, maybe a comment and a question. Dr. Giddens and Dr. Campbell have been phenomenal. Ingrid Bruce and her staff have really been phenomenal in supporting the community of caring, having the doulas there, having them get their observations, really ingratiating them and inculcating them in the delivery staff, making sure that they're advocates, that they have a voice, that they're not separate to the delivery team, which has been phenomenal. And usually the biggest hurdle, like you said, are the physicians, gaining that acceptance of the doula communities from the physicians. And I think you have done a phenomenal job just changing the culture of what's happening with the physicians and the nurses with the doulas. Speaking about the medical school, we're always talking about the health inequities and making sure that we have everyone at the table. One of the major hurdles that we're facing now throughout the nation is the lack of diversity in the medical field. When you talk about nurses, providers, just entirely throughout. We're looking at cultural congruence, racial congruence, ethnic congruence. But additionally, we know that there's a shortfall of primary care physicians and nurses nationwide. So how are you at University Hospital really attempting to address those issues?
Well, so we do it in multiple ways. So when it comes to the non-doctor activity, because that's a New Jersey Medical School activity, and I can share a little bit, but in the non-doctor activity, whether it's nurses or technicians, We have multiple paths. The paths that I'm most excited about is we have invigorated in a deep way a commitment to the communities that we serve, starting at the high school level. And so we're going to start, we've already started down a road where we are integrating our philosophies and our ideas and our education so that high schoolers can begin contemplating careers inside of University Hospital. And we're specifically targeting the city of Newark students and East Orange. Beyond that, now at the college level, we are intimately connected to Essex County Community College, which is really a representative of a broader region, but quite honestly, their demographics resemble our broad region, so that's wonderful. And so we're deepening ties there. When you put it all together, I think what you'll find over the next 4 to 10 years is a production of people that are sensitive to the needs of the community, will also resemble the community, and you put that together, there's magic.
Absolutely. Yes, 100%. So we talked about the opportunities before, but I know that there are so many things that you're proud of at University Hospital. Talk to me about all the wonderful things that are happening at University Hospital.
Well, so let's stay on the maternal one, because I think there's great information about our C-section rates. You know, across the country, again, if we were to Google, we would find that to be a significant priority across the United States. How, and it mostly is phrased as, how do you achieve lower C-section rates? Well, I am proud that at University Hospital, we have extraordinarily low C-section rates, the best in the state, amongst the best in the country. And so there's a real robust commitment to the health and well-being of women. So I think that's been wonderful for us. It's a level of pride that I think everybody has. So that's wonderful. And also something that
Before
recently,
you go on to the next things, so what do you think the secret sauce is? So when we have other people and we have people watching and they're like, well, what are they doing at university that we can't achieve here? What do you think that secret sauce is?
well, so I think there's a lot of things. So one is going to be unique to hospitals that have residency programs, physician training programs. Hospitals that have physician training programs will always have an obstetrician in-house, which means they're not rushing to go do something else outside of the hospital. So for those hospitals that have physician training programs in OB, advantage one over a hospital that doesn't. The second thing is that because of the faculty's orientation to our community, we are really aware of how our community thinks and the needs. Some of the things that come forward about our community is that there's a deep interest in learning about the process of having a baby and what to do next. And so when you can have that robust conversation, you can get into how to move forward down a path of natural childbirth, right? I mean, just, you have the time, you have the interest, it's a two-way street. It creates a dialogue that's wonderful. Number three is you do have a physician workforce and a nursing workforce who are really proud of the idea that we want to have low C-section rates. So when you connect those three dots, you are on a path towards success.
Wonderful. And I know I did interrupt you. You were telling us about the other great things that are happening at University.
Well, I just wanted to share one more, because this is another example of commitment to a community. In this case, it's a much broader community. Recently, we learned that we have the #1 survival in the United States for liver transplantation here at University Hospital. It is amazing. You know, in the world of modern medicine, there's a few things we can say are life-saving. There is zero question that transplantation fits in that. And so for anybody who's ever undergone a liver transplant, you know that it's a new lease on life. And to have the #1 survival in the United States means that, pretty simply, nobody should ever cross a bridge out of New Jersey if they need a liver transplant.
That is a really amazing feat. Congratulations, and congratulations to your team.
Thank you.
That's really great. So what are you looking forward to in the next, say, 2-3 years?
Well, I think we're going to make dramatic improvements in how we impact the care and the outcomes of residents of our community. maternal deaths across the country are problematic. We're really happy with our results here, but we want to keep driving it in the entire area. Breast cancer screening. We know from data that in Essex County, women get screened later. And when they get screened later, we find advanced disease more often. So we are going to make a dramatic push in getting women screened, providing education, and then certainly providing the care that they need. So those are examples of where we're going to drive harder to impact our community's wellness.
That's amazing. Thank you so much. And I do have another question that is kind of not regarding here. But if you were going to author a book of your life thus far, what would the title be and why?
Well, I am going to steal the name of another book that already exists. And the book is called The 5 People You Meet in Heaven. That book was actually written by a sportscaster named Mitch Albom. But the reason I would steal that name is because, like I mentioned earlier, my silly what I would be if I wasn't what I'm doing, that I'll be a bartender and own a sports bar. What I get to do is I get to support the many people who work here, and hopefully what they are able to do is provide great and amazing things. And for me, I'd love one day to be able to see how those great things have impacted people. And I see it now because I have a front row seat to greatness. I mean, I literally have a front row seat to the greatness of university hospital employees and faculty. But over time, I'd love to see that a nurse or a doctor who saved a life or did something amazing, what that person's doing in 5, 10, 15, 20 years. Because I do imagine that that person will never, ever forget their doctor or nurse. It's kind of like for me and maybe for you, we have that one teacher that will be forever etched in our heads. And for that teacher, they may have had 1,000 or 5,000 or 10,000 students in a lifetime. And maybe we're just a little blur. But for me, that one teacher never goes away. I bet you for those patients that our staff and faculty touch, their faces don't ever go away. And it'd just be great to see their journey.
That is wonderful. Thank you. Thank you so much. And thank you for your insight. And I know that you have to go. Thank you for spending a little time with us and telling us exactly what University Hospital is doing to change the paradigm in maternal health and to change the paradigm throughout the community and public health. Thank you so much for your time. And thank you for joining us for Partnership Live.
Thank you. Take care.
Take care. Bye-bye.